difference between the pain clinic and the other specialities. The other methods we use is what we call interventional procedures. We do different sort of blocks, and we use local anesthetics into these drugs. And a lot of people are familiar with using local anesthetics and steroids. We do that like in back pain. We use epidural steroid injections, and a lot of people hear about these injections.
Yes, right.
And also we are using things like the joints around the back or the neck pain, and especially if the pain include nerve injury, and then we can use all these blocks that we use. Other things we use sometime if we have a post-operative surgical pain, we can use other also blocks to control this pain. Blocks, I mean by injections, well-controlled injections. We know where we are going, and we do it under control of X-ray, and we know that we control the amount of medications that we are giving the patient, and should be given in a hospital setting where we have all the monitors, all the medications that we need in case any problems happens. The other things we have is burning the pains, the nerves, sorry. If you have things like back pain, and the responsible about the back pain is the disc compressing the nerve, or you have canal stenosis, spinal canal stenosis and compressing the nerves, or other nerves, we do something called radiofrequency lesioning, yes, which is basically burning the nerve. But what we do controlled burning of the nerve, and we call it, especially nowadays, pulsed radiofrequency. So it's all controlled. What you do, you kill the pain, and the pain usually disappears completely, but you preserve the motor function of the nerve, and you preserve the feeling itself, and you preserve the other varieties.
This is very interesting, by selecting just the
yes,
pain type stimulating part of the nerve, yeah, and reserving the other functions. This is very
yeah, especially
interesting
with
how
the
you
new
achieve this.
Yeah, and we do have it now in Kuwait, and we have it in our hospital, and we are offering it for patients that we do the block at the beginning, and if the block of the nerve shows some response, then we proceed and do the radiofrequency, which is burning the nerve.
This is excellent. So, and this is in different situations and places, as you've mentioned, both in the neck, the back, and other places, as you said, wherever there's a nerve need to be handled.
Yes, I mean, with technology, they used to do it only for the back and the neck, but then with advanced technology, advanced needling, and advanced machines, advanced control of the heat that we use, we all do that for different type of nerves, and every day we are seeing more research growing in this field.
And this is having a long-term type of results, or does a patient comes back with other problems or having other complications from such a method?
Usually in the past they used to we see some complications, a new type of pain. We call it neuropathic type of pain. But nowadays with the new technology, especially as I said with the pulsed one, we rarely see any harm at all. I don't see any harm at all with these radiofrequency lesionings.
Okay. Is this the spinal cord stimulation?
No, that's what I'm coming to is yes, the new technology.
Okay.
There is the new advance in pain management, and this is where my area of interest. I mean, there is a few number of patients, I won't say a few number of patients nowadays. In the past, people thought this type of advanced technology, because it is expensive, because it's difficult to manage the patient after you put all these machines into the patients or devices, and because it's expensive, as I said, and selection of patient was difficult. Nowadays, we believe that we should use them early in our management. There is a lot of research nowadays to support the use of these devices. One of these devices is we managed to insert both of these devices here in Kuwait for Kuwaiti patients, and they are doing very well. The first device is the spinal cord stimulator, and it is like the pacemaker. It's a small device, and I have it actually here with me, and this is in the size of like a pager. And it is completely implantable. We put it under the skin.
If we can, from our director, have a close look on the device with Dr. Asmhan.
This is the device. This is the device that we use,
yes,
and it is in the size of the pager, and it is completely implantable. And this is will be implanted under the skin, at the lower area of the back or a lower area of the abdomen, and then we connect this to a lead. and the lead will be connected to electrodes, and these supposed to go into the epidural space, which is the space just outside the spinal cord. And then we go to a certain level which match with the pain. And then there is electrical stimulus, which is generated by the battery I just showed you now, which send impulses to these electrodes. And these electrodes will generate impulses which will superimpose or cover the area of the pain and give the patient pleasant sensation. And this pleasant sensation will cover the area of the pain. And you have a programmer, and the programmer, you give it to the patient, and there is another programmer which stays with the pain specialist. And this programmer can control the amount of electricity the patient gets, and it will control how much the patients need. And even if they develop a new pain or they are doing extra activities, they can add more electricity and add more control on the pain. Of course, with the technology, it's becoming, the patient are very comfortable with it because it's going smaller in sizes, and because it is unevident, and because the patient are more familiar with less complicated technology from the patient side. And because it's programmable, it's very much easier to us. But as I said, you need to select your patients. There is a lot of evidence on putting these devices into patients with low back pain, especially a condition called failed back surgery syndrome, where patients have a disc or a spinal stenosis, and then they develop, even with one surgery or two surgeries, they still have the pain.
Yes,
they still have back pain and leg pain, and mainly leg pain. Those patients will benefit, according to the studies, from this sort of advanced technology. The other advanced technology, the other type of patient who will benefit from this is patient with leg pain or arm pains due to diabetes.
Yes. And we have a lot of them here in Kuwait.
We call them diabetic neuropathies,
yes.
And it's a painful diabetic neuropathies. These patients can benefit from such devices. Other patient with the vascular diseases, or patient following amputations, patient with cancer pain sometime, and sometime patient with neck pain as well. The other device we are talking about,
Before we go to the other device, Dr. Asmhan, how frequent patients have to follow with you to maintain the efficacy of such a device?
Of course, we have support for these patients 24 hours every day a week. They can call a number, and we have a technician from the Ministry of Health and also from the company to support this patient and ourselves. They can call anytime. If there is any problem with their device, if they have any problem with restarting their device or closing their device or increasing the quality of pain relief, they can do all that 24 hours a day. And also, I see them on a regular basis, once a month or twice a month, according to the condition of the patient.
Yeah, this is great. Now, this is initially the starting when we are talking about the non-pharmacological device. You've talked about the spinal cord stimulating devices, but there is the more revolutionary type and the more advanced one, the one we are all looking for to talk about and more in-depth. Can you please talk about the next type of device?
The second device we just inserted, which is, it's a variety of devices, and it is called intrathecal pump infusion device. And we managed to insert one last month for a lady in Kuwait, and she's a Kuwaiti lady with back pain and leg pain. And there is a lot of indications for such a device. This device is like a pump. You insert it under the skin, and it is completely implantable. And then this device will contain the drug, which is a concentrated drugs, which is an advanced type of painkillers or more powerful painkillers. These devices will be connected to a catheter which goes into the spinal cord and then into the space where the drug can be delivered immediately into the spinal cord and the back of the patient, and then it will be spread to the whole body. The beauty of this device is those patients, if they cannot take anything orally or cannot tolerate injections, or when they take this medication, they show some response, but then they show side effects,
sure,
like nausea, vomiting, drowsiness, visual problems, and all these things. Then this is the best choice for them. Of course, you need to know what type of